Folks, welcome to another Washington County Public Affairs Forum. I'm Eric, your president, and I want to remind you that we've got some hardworking servers in the house. Shalina, Paco, and Chris do an excellent job behind the scenes making sure that your food shows up and you get what you ordered. Please remember them with a gratuity as you check out. And what I'd like to do is remind you that we've got two programs. We've got Dave Waffle from City of Beaverton, and Cover Oregon has sent Courtney Helstein, but hell with one L. And, come on, that was funny. And I had to tell you it was funny. I'm sorry, this is a tough room to work. I'll be here all week. So just for that lack of laughter, I'm going to introduce the Hip Hop Hooray, which is the Every Bunny Loves a Discount $1 off Easter buffet. So if you don't laugh at all the jokes, you'll be compelled, per your membership, to show up at the Peppermill Easter buffet, which happens from 8 a.m. to 2 p.m. Easter Sunday with reservations encouraged. With that being said, and that horrible delivery of that joke, I'd like for some applause for Courtney from Cover Oregon.
Thank you, everyone, so much for having me. Again, my name is Courtney Helstein, and I should say that my work is very centered around the happenings of Cover Oregon, but however, I actually work for the Main Street Alliance of Oregon. And I've been traveling around the state for the past 6 months, connecting with small business owners in Oregon and the general communities in a lot of rural areas in our state. Helping to kind of bring clarity and help get folks through this very new and I'll bet very complicated process, maybe more than it was originally intended. And so that's what I've been doing, helping folks get the knowledge that they need to make the right decisions about their healthcare options here in Oregon. So just to kind of get started, I'm going to have just kind of a brief presentation to kind of go over some of the major aspects of the Affordable Care Act and Cover Oregon, talk a little bit about the individuals and family side, a little bit about the Small Business Health Options Program, or SHOP, and give a little bit of an update in regards to where we're at as a state when it comes to the implementation of the ACA. And then after that, I'll definitely have time for questions. So just if you do have any questions, just hold until the end, and I have plenty of time to hang out and talk with folks here if you need any assistance. Great. So without further ado. So who is the Main Street Alliance of Oregon? So we're actually a coalition of, this says nearly, but I have a new update, over 2,000 small business owners across the state of Oregon. And our mission is to kind of empower our small business community and our neighborhood businesses here in the state to have and connect them with opportunities to speak on behalf of themselves on really important public policy issues that are affecting our small business communities here in Oregon. And we also we also thought it was very important with the rollout of the Affordable Care Act and the creation of Cover Oregon in the state that there was really good small business representation within Cover Oregon to ensure that the needs of small business owners and supporters of local economies here in the state to have representation. So two of our members that are leaders within the Main Street Alliance of Oregon, one actually sits on the Cover Oregon Board of Directors, Jose Gonzalez from Salem, and Jim Hauser as well sits on the Consumer Advisory Committee to Cover Oregon as well. So we've been also, along with our education and outreach on options for small business owners, we've also been pushing really hard to make changes to Cover Oregon and to our state health exchange to make sure that we can continue to move forward and that it's going to be a successful product for Oregonians. Awesome. So protections for everyone, right? So a lot of folks know this as the Affordable Care Act, or even more people refer to it as Obamacare. And really the full title of the legislation that passed and was signed into law in 2010 is the Patient Protection and Affordable Care Act. And so I just want to kind of hit a little bit on the patient protection portion of the ACA that a lot of people don't realize is actually written into the legislation. So first is the end of lifetime limits. So what this is that insurance companies can no longer put a monetary cap on the amount of money they'll spend on your care over your lifetime or over the lifetime of the policy that you have with that insurance company. So, for instance, this is a pretty big deal for a lot of Oregonians, particularly folks suffering from chronic diseases or folks, young people who have been diagnosed with debilitating or chronic diseases at a very young age. So, for instance, one of my best friends, Megan, when she was 17 years old, she was diagnosed with cervical cancer, and she's 27 now, and this was a big deal for her because now she doesn't have the fear of getting to age 37, 10 years down the road, and getting kicked off of her plan because her insurance company has said, nope, that's it. That's all the money we're going to spend on you. So free preventative care for new plans. So every time you go into the doctor for a checkup, for a wellness visit, there's no copay. It's free of charge, and this was written into the law to ensure that we did a little bit more at preventative care, so we could learn a little bit more about chronic diseases, about cancer, about potential health risks for individuals before they became a real issue. Young people can stay on their parents' plans until they're 26. No denials for coverage for pre-existing conditions. No charging more because of your health status or your gender. So I'm pretty excited. All the ladies in the room, we no longer, just our status of being a woman is no longer a pre-existing condition. So that's good. I would disagree. I don't think it's a condition, but so no annual limits. So if you have a particularly trialsome year in regards to your health, you don't have to worry about reaching a limit over the course of 365 days and then still needing care after that and potentially going bankrupt. And along with that, there's also caps on deductibles and maximum out-of-pocket expenses per every year. And there's also subsidies for individuals and families and tax credits for small businesses, and I'll get into that in just a second. So one interesting thing that I always like to talk about is Medicare. So for the most part, through the Affordable Care Act, Medicare has been largely untouched, except in a few areas. I'll bet they're pretty significant areas. So one, no copay for preventative care in Medicare any longer, and that's been in place since 2010. A $250 rebate for prescriptions if you fall into something called the donut hole or a coverage gap. And essentially what that is at some point in the middle of the year, you've reached your maximum of Medicare benefits for prescription drugs. You fall into what's called the donut hole, and you have to figure out a way to pay for those prescriptions out of pocket. And so what this does is if you are someone who falls into that, you receive a $250 rebate from on your prescription drug purchases from the federal government. And also, if you fall into that, you get if you need a name brand drug, you get 50% off that. And the donut hole or coverage gap is planned to be closed no later than 2020. And we've also seen since about 2008 is when it really started, and it's really amped up over the last few years, is a crackdown on waste and fraud. And so in between 2008, 9, and 10, I don't have any more recent numbers. About $4 billion was returned to the federal government from kind of cracking down on Medicare fraud. And so that's pretty interesting to hear. And it's that type of waste reduction that's going to allow them to close that donut hole or that coverage gap. Great. So there's been a lot of standardization as well that's come out of the ACA and is being implemented across all 50 states. One of those is premium cost versus cost share. So they've created a system, kind of a metal tier ranking system, platinum, gold, silver, bronze. And they work similar to like Olympic gold or like Olympic medals, right? And what it does is it's a ranking system that they've used to help individuals better conceptualize what their premium costs are going to be versus what kind of out-of-pocket costs that they can expect when they actually go to receive a service from a medical provider. So we have platinum plans where the premiums are going to be the most expensive out of the plans that you can purchase, but you're gonna have the lowest cost share, right? So for instance, if you're someone that needs a lot of that you go to the doctor a lot, maybe you have a lot of prescriptions, maybe you have to see some specialists, or you're in this and you really need long-term care. It might be a better overall for you to get a platinum or a gold level plan, as opposed to a bronze level plan where you're going to be paying a premium and then you're still going to have some significant out-of-pocket costs, right? However, maybe for someone who's younger, really only uses healthcare when they get sick or something happens, purchasing a bronze plan might just make more sense for that individual if they don't have a lot of prescriptions or don't need a lot of healthcare. There's also something called the catastrophic plan. And this is a plan that's it's only available to folks who are 30 years of age or younger at the time that they purchase the plan. This is they have the cheapest monthly premiums every month, but they do have higher deductibles and higher out-of-pocket, obviously higher out-of-pocket costs. So that's really for someone who only goes in, they put off going to the doctor over and over and over again until it's really an emergency and they just need some type of care. But it's not necessarily going to offer, the average person peace of mind every time they go, if they have the flu or if they sprain their wrist or something like that. There's still going to be significant out-of-pocket costs. Also wrapped in to the ACA is or the Affordable Care Act, I apologize, is something called the 10 Essential Health Benefits. So that means that, so there's only 5 here, I'll go over the other 5 as well. But in every single plan, whether it's being offered through Cover Oregon, our state-based exchange, or whether you purchase it in the private market, there's going to be some level of coverage for these, what they've called the 10 essential health benefits in every single new plan. So some folks who renewed an existing plan in 2013, some folks won't see this fully rolled out yet, since a lot of these weren't required for people that renewed in 2013. But what you'll see once you renew your plans in about a year, most folks will have these wrapped into their plans. So we have outpatient care, right? So that's like the most common type of care. You get sick, you get injured, you go in and you ask what's wrong and you get help. The coverage for prescription drugs, preventative and wellness care, and again, all preventative doctor care visits or wellness visits have no copay. Mental health services, emergency care, and that's not just once you get to the emergency room, but there needs to be some level of coverage for if you need an ambulance as well. Hospitalization, rehabilitative and habilitative care. So things like if you need chiropractic care, physical therapy, things like that, pediatric care, maternity and newborn care, and laboratory services. Great. So one of the things I talked about, right, was the tax subsidies. And so this is a little bit of a breakdown for folks that purchase plans through Cover Oregon on our state exchange and the individuals and family side. And this compares your family size to the maximum yearly income that you can have to receive some sort of federal assistance to help you pay the cost of your premium. So for instance, for a family size of 1, your maximum yearly income it's nearly $46,000, and for a family of four, just over $94,000. And I always like to show this because sometimes when I'm talking with folks about it, and they're like, I don't know, I think that I'm not sure if I can afford it or if I'm going to qualify for anything, and I always encourage them to at least go and take a look, because I know when I saw these numbers, I was pretty surprised about the income levels attached to subsidies. So even a family size of one that's doing pretty well off, middle class, can qualify for some sort of federal subsidy. And obviously, the lower income that you have, the more federal assistance that you will qualify for. Right. And so there's also something that was created out of the ACA and is now being implemented either through the national exchange, healthcare.gov, or like here in Oregon, we have Cover Oregon. And so it's called the SHOP program, Small Business Health Options Program. And what this is creating is a marketplace for truly small businesses. So businesses from anywhere from one to in 2014 to 50 employees can go and purchase a group plan for them and their employees, which is something that was really difficult for truly small businesses, right? So businesses from 1 to 10 employees, it was really hard for them to actually get a quote from an insurance company if they wanted to provide coverage, let alone one that they could afford, where premiums weren't $700, $800, $900 for just one employee every month. And so they created the SHOP program, and this is kind of the timeline for this rolling out. So in 2014, you can see individuals are open to enroll, and businesses from 1 to 50 employees can purchase group plans for their small business. In 2016, that goes up to 100 employees, and in 2017, it's over 100 employees can purchase group plans through the exchange. For small businesses in Oregon, there's over 70 plans that are offered across the state. Not every single plan is offered in every single county, but there's a substantially higher choice here in Oregon with our state-based exchange than there is at healthcare.gov. So we're lucky in that respect. And it's also created a little bit more competition when it comes to the cost of the premiums. So, for instance, when about a year and a few months ago, when all of the insurance companies kind of presented their premium costs for all the different plans that they were going to offer to the Oregon Insurance Division, one of them, I believe it was Providence, saw everyone else's premiums, and they were like, "Oh, ours are a little high. We're going to go back to the table, recalculate this a little bit, and then come back." And they raised it, or they lowered it about 20% from the original cost that they had submitted. Right. So just like individuals and families, there will be several small businesses that will qualify for the health insurance tax credits to help them cover the cost of the premiums for their employees. So let's talk about tax year 2013, right? We're, about a week away from tax season the filing deadline. So for businesses this year who are filing for 2013, if your business employs 25 or fewer full-time equivalent employees whose average wages are less than $50,000 a year, and if you as the employer agree to pay a minimum of 50% of the cost of the premiums, then the federal government will give you a tax credit of up to 35% of the cost that you've paid in their premiums, okay? And so fast forward to next year when we're filing for 2014, that tax credit bumps up to 50%, except there's one caveat. You have to, that plan that you've been providing for your employees through your business has to be purchased through the exchange, right? So you're probably thinking, well, we don't really have one right now. We're the only state without a working online exchange. About 2 weeks ago, most businesses would have been out of luck to get the tax credits for 2014 and 2015. But about 2 weeks ago, when the governor announced the deadline extension to April 30th for individuals and families, he also announced that there would be a way for Oregon small businesses who qualify under these three determinants to receive the tax credits for 2014. And I'll go over that for right now. So I will say it's not a simple process, and it's not going to be something that's going to happen over the course of a day that you'll be able to figure out. It's definitely, while working for an organization that advocates for small business, we are a little frustrated by the setbacks that have happened. And however, we're glad that they've created at least some sort of temporary system for folks to not only purchase plans for their employees, but also have a system for them to get the tax credits that they have been promised through federal legislation. So the first step is an employer purchases or renews a Cover Oregon certified medical and or dental plan from a participating insurance company, right? So those are the insurance companies that have decided that they want to offer plans through Cover Oregon, through our state-based exchange. The step two, the employer or their insurance company appointed agent sends a request to their insurance company for to be determined eligible for these small business tax credits. Then the insurance company that gets that request sends the group policy information to Cover Oregon. And on the employer's behalf. Step four, once Cover Oregon has that information, they determine, based off the three criteria that I went over, whether or not your business is eligible for the tax credits. And they send out something called an eligibility notice to the insurance company, the agent, and the employer that says, yep, based off the information that was submitted to us, this business is eligible to receive, or this is eligible to apply for the small business tax credit. Then, when you get ready for tax season for the 2014 filing year, you take that eligibility notice and you give it to your tax preparer, and they help you apply for that tax credit, and the IRS will make the final determination on whether or not you qualify for that. I can say that this tax credit has been available to small businesses since 2010. So if you think that you may have been eligible before that, you can actually still file an amendment to the taxes. You can talk to your CPA or your tax preparer, and you can get apply for those tax credits going back a few years. Even if there's a small business owner in here that's already filed their taxes for 2013, it's not too late. You can still file an amendment, and you can still take advantage of the tax credits in 2013 if you think that you may qualify. If you have more questions about that as a small business owner, just tag me, and I have some of my cards. I can pass them out before I head out today, and we can set up a time to chat. Great. So that's kind of the lengthy process of determining eligibility. However, if you think you may qualify, it's definitely worth taking a look at. I've talked with a lot of business owners who've been taking advantage of the tax credit since 2010, and they've received anywhere from $4,000 to, I even know one business owner that received over $13,000 in a tax credit. So every little bit helps, right? Right, so now I just kind of want to give a little bit of an update in regards to kind of where we're at numbers-wise when it comes to enrollment in ACA as a whole, and then also here in Oregon. So as of last week, I believe last Thursday, enrollment numbers in Oregon reached 331,000. So to break that down even further, 59,000 private plans have been purchased through the exchange, through Cover Oregon. 141,000 Oregonians have been determined eligible and have enrolled through the Oregon Health Plan through filling out an application with Cover Oregon. And 131,000 through something called Fast Track. And it was something that Oregon kind of pioneered this idea, and a few other states have taken it on as well. They used existing information within kind of state portals for folks who access services like SNAP, so food stamps, or TANF, or so on and so forth. Took their information that they already had about income, social security number, contact information that was already in a state system to determine who in that list was eligible. Then they mailed out letters to all of those individuals. I think about 170,000 of those letters went out. And it basically said, hey, all you have to do is check this box, mail back this letter, and we'll automatically enroll you in the Oregon Health Plan because we know, based off information that we already have, that you qualify. And so they deemed that Fast Track. And there's still about 40,000 letters out there, and there's no deadline for folks to get that turned in because while there is an open enrollment period that's ending on April 30th for folks that are purchasing individual plans through Cover Oregon, enrollment for the Oregon Health Plan, as well as small businesses who want to purchase plans, group plans for their business, that enrollment goes on throughout the year. And so folks can get that turned in at any time. Great. And again, as I mentioned, enrollment deadline is extended until April 30th. So what that means is you need to have your application in by that date. And then within a reasonable amount of time afterwards, they say reasonable amount of time. Cover Oregon, Health and Human Services, at the federal level haven't necessarily determined an exact number of what's a reasonable amount of time. But I would just say as soon as you get information from Cover Oregon into you after you apply, you should probably just figure it out within the next week. There is a lag time in Oregon. Again, as I said, we're the only state that doesn't have an operating website yet. And so we're doing everything I'm not, thank God, but folks at Cover Oregon are doing everything by hand, manually entering all this information in. And so I just want to encourage folks, if you do still need to get coverage, and you haven't done so yet, to do it as soon as possible to kind of avoid the end of the month rush, where my guess is they'll probably be getting several thousand applications in the last week each day. And then nationwide, over 7 million folks have, and that's just through folks that have gone through healthcare.gov. That hasn't accounted in other state-based exchanges across the U.S. So I think it's actually over 7.1 million now. And enrollment deadlines have been extended in various different forms in a lot of places across the U.S. And so we're probably going to see that number tick up. And it may even reach at least close to 8 million nationwide going through healthcare.gov. Right, so that's kind of all I have for you today. I'm kind of going over some of the basic parts of the Patient Protection and Affordable Care Act, and kind of giving an update on what's going on. I can say that I'm frequenting all of the board meetings and the Consumer Advisory Committee meetings, and working really closely with folks inside of Cover Oregon to make sure that they are that they can eventually produce a product that is going to be a good thing for Oregon, and continuing to make improvements to the legislation in the future to make it even more and more successful. So as I said, this is my information up here, and the state director as well, Stephen Michael. Healthcare is one of, obviously, an important public policy issue for a lot of small businesses here in the state of Oregon, but we also work on a myriad of other issues, from tax fairness to retirement security for folks that own their own business. So please feel free to get in contact with us. As I said, I'll leave some of my cards at the back of the room for folks that want to get in touch. And now I will open it up for questions.
Hi, Jim Cape, floor member. It's been said in the media that the covering existing conditions cannot be called insurance, that is actually a subsidy or charity. And then like in the Between Two Ferns parody, that the only way the act can balance is if young, healthy, single people are overcharged or have to overpay to cover for families and everyone else. Can those not politically correct realities be discussed?
Yeah, I think that's a good question. So to kind of talk about the pre-existing conditions portion, right? So you can't be denied coverage for pre-existing conditions any longer. I think that's what he was getting at. I've had a lot of people ask me about that, and that has actually been tied to the individual mandate, right? So where you need to have, you're being required to have some form of health insurance in order to avoid tax penalties. And so those two things are tied. So when they were negotiating, before the bill was passed, when they were negotiating, trying to write the legislation to try and push it through Congress, it was kind of a bargaining chip. So insurance companies said, well, if you want to keep no denial for pre-existing conditions, then we have to add in an individual mandate where everyone has to provide coverage so that folks who, like a lot of young people, we all think we're invincible, nothing's ever going to happen to us until it does, force them to become a part of the exchange to help, cover the cost of folks who are sick. It's just kind of the risk pool thing that's going on. And so I think in general, in a lot of instances, we've seen prices go up a little bit. But I think that that's attributed to more than just that factor. It's also attributed to things like including the 10 essential health benefits as well, where it's included in there that no matter what plan you have, you're guaranteed some level of coverage for at least these things. So in general, we're getting a more comprehensive package now with insurance. So we might see and a lot of people have seen their premiums go up. I think in the first year where we've had kind of no precedents really set in regards to prices and how they should be attached, we didn't know if people were going to sign up for this thing actually. I think that I don't think that we'll really fully get a grasp of what the cost is really going to be long term for folks until about 4 or 5 years in. But that's a good point. There are some people whose it's rising. And to kind of create a little bit more of that risk pool, there is a good chance that some folks, and including young people, are going to have to pay a little bit more than what they normally would before.
Good afternoon, Jerry Arnold, forum member. Thank you for coming today.
Yeah.
I read in the New York Times last month that Multnomah County Corrections worked with Cover Oregon to sign up about 12 or 1,500 inmates. Mm-hmm. One of the things that inmates will have then is some sort of coverage after they get out. The beauty to it, as I understood too, was that the transfer of dollars in case that inmate goes into a hospital for 24 hours or more. Any idea of what the impact that's going to be on folks like Multnomah County or the rest of the state? And are they signing up with Cover Oregon also?
Yeah, that's a really good question. So I know a little bit. I know some information on this, but I don't have a fully comprehensive answer. It's a well-known fact that in Multnomah County, there's a super majority of percent, and I don't know the exact percent, so I'm not going to say, but I know it's the majority of folks that are entering into our prisons suffer from some sort of mental illness. And so there's an effort made by the state and by the correction system in an effort to reduce recidivism for folks that are leaving that system and entering back into society, to ensure that they have some sort of easy access way to get coverage, so that as they leave that system, They've already have access to the prescription drugs that they need, to a primary care provider, to kind of make sure that they're not going any extended period of time without the medications that helped them when they were in prison. I think that there will definitely be some huge impacts down the line, and they may not be visible right away when it comes to the cost of our correction system, as health outcomes in a lot of different studies have been directly related to whether or not folks go into a cycle of recidivism in our. So I think over the long term, when those folks are leaving the system, that it could have a huge impact on that. So did you say that they're getting folks signed up while they're still in prison, and so the cost goes off of the justice system and onto yeah? Okay, great. I hadn't heard about that. Yeah, great. I think that's a great idea personally, because I think that it helps make a more seamless reentry into society if they already have that access and they already know providers that they can go and talk to get any type of medication that they need. And we've also seen not only will it cover prescriptions, but one of the things that 10 Essential Health Benefits does is mental health services. So I imagine that over a long period of time, it could have a pretty significant effect on a state level for our criminal justice system, as well as Multnomah County.
Sally Bunnell Forum member. How does this work for seasonal employees? You know, they cut Christmas trees in December. They're picking fruit in Washington and Oregon. August, September.
Yeah, that's a really excellent question. I'm glad you asked that. So there's a few things. So a lot of times seasonal workers, when they have, a huge portion of the year or sections of the year where they have income, right? And so when you're applying for Cover Oregon or you're applying for the Oregon Health Plan, what they do is they ask you for, okay, what is your estimated income for this month? What about next month? What about for the year? And they take that look and you try and make your best guess of what your situation is going to be like in the months ahead. And that's actually how the primary way that they use to determine whether or not from your application, if you would qualify for something like the Oregon Health Plan year round. And for other folks who would go over that wage limit to qualify for the Oregon Health Plan, for folks like seasonal workers or temp workers, or someone who's lost their job, if they got married, if they had a child. These are if they've moved from another state or out to another state. These are things that are called qualifying life events. And so if any of these types of things happen to you outside of the normal open enrollment period for folks to purchase private plans through Cover Oregon, you actually get kind of a little special enrollment period because of this qualifying life event, so that you can get access or move through private insurance and the Oregon Health Plan throughout the year.
Thanks. You're off the hook.
Great.
How about some applause for Courtney?
Yeah. Thank you, everyone.
Thank you. Thank you. Yes, please. Just pull that off to that table. Folks, how about some applause for Dave Waffle, City of Beaverton?
Thank you very much. Honored to be invited to the Public Affairs Forum today. John McWilliams contacted our mayor's office last week after hearing a presentation by Senator Elizabeth Steiner Hayward to the City Council last week. She was giving her overall legislative wrap-up of the 35-day session, and that's an issue unto itself. You might ask her to come back, or any of the other members of the local delegation. I think they have some interesting observations about how that works, but that's not today's subject. I'm going to talk about the Beaverton Community Health Collaborative, which is related in spirit to the presentation we just heard from Courtney. I want to thank her because it's a good tie-in. The Beaverton Community Health Collaborative, known as BCHC, so if I revert to that, an acronym, that's what I'm talking about. Beaverton Health Collaborative is a group of agencies, many of whom you are familiar with. They are medical providers, public, private, nonprofit, social service providers, and educational institutions in Washington County that are probably very familiar to you. It is Virginia Garcia Memorial Health Center, Pacific University, LifeWorks Northwest, one of the major mental health providers in the area, Community Action of Washington County, Women's Healthcare Associates, which is one of the largest OBGYN providers in Washington County, in the region, Providence Elder Place, associated with Providence Hospital, and then several private businesses that are involved as developers and designers of the facility, a company called Erdman out of Wisconsin, and then Pacific Medical Buildings, which is a major developer of medical facilities throughout, up and down the West Coast. They're out of San Diego, but they have over 500,000 square feet of medical facilities in the Portland area, including one of the buildings at Tualatin. The city's role is a little unusual, that cities would be involved with providing, involved in healthcare. We are not providing healthcare. My day job is assistant finance director. I'm the project director for this particular project because I was initially in the community development department, and it's an extension of community planning, concern for the wellness of the community that gives us kind of our interest in healthcare. So the city's role has been as convener, has been as facilitator of these people coming together. Because I only have a short time today, I'm going to concentrate on a facility that they have designed, have nearly completed the capital phase of. That would be tentatively at the Beaverton Round at the old Westgate Theater site. Some of you may have sat in those aisles decades ago. But that's what I'm going to concentrate on, just is that piece. We'd like to come back some other time and bring in the partners from those agencies to talk about what they're doing to integrate care that really helps meet the intent of health reform and the Affordable Care Act in Washington County. So that was the who. The what is this approximately 70,000 square foot facility that is being planned on the Westgate Theater site. It is not a healthcare facility. It is a wellness facility. It is about healthcare. It is about mental health. It is about encouraging healthy living. For example, healthy eating. For example, there would be a teaching kitchen in there to teach people to how to prepare good, healthy meals for their families. It is a teaching facility in that Pacific University students, whether they're in occupational therapy, physical therapy, dental, any of the specialties out at Pacific University would be involved in the treatment teams as in their clinical rotations that we want students to do because I know I want some well-trained students coming out of our universities to take care of me and the other baby boomers. They're going to need a lot of care, and since this notion of integrated care, of having mental health specialists working alongside primary physicians who also can refer people to community action because maybe there's a need for some housing rehabilitation or some energy improvements in their home. Having that team approach to a patient-centered business just makes a lot of sense. It's the notion of a collective impact having a much bigger payoff if we're all working together for these families. The facility is, I use the term patient-centered. It is, and our best example of that is that, you know how big your patient exam rooms are that you go into now? They're a little crowded and cramped. Well, imagine if you had 3 or 4 providers come into that room, a student and a mental health specialist and so forth, you'd get crowded pretty quickly. So we're going to have larger exam rooms. That's just an example of the integrated care. A lot of the families come with, or a lot of the patients come with families. The where I mentioned was tentatively the Westgate Theater site. That is about a 4-acre site, and right now the idea is to build on maybe a third of it, kind of the corner, about where the theater itself was, down in that corner on Rose Beachy and Rose Beachy Boulevard, at the Max tracks. It's opposite City Hall. City Hall will be moving into the South Office building, or what some people call the Caldwell Banker building. We'll be in there in August. We hope that this is, we plan on this being phase 1 of development on that site. It initially would be, the current plans are it would be initially built with surface parking. The idea is that we would then seek offers for redevelopment of the rest of that parcel, maybe towards Cedar Hills Boulevard, and eventually then replace that surface parking with structured parking. That whole Creekside district around needs more parking in order for dense urban development, transit-oriented development is the phrase, in order for that to happen. But this is thought of as just phase 1, working with the other property owners in that area. There are some of our friends here from the Beaverton Chamber of Commerce. We've been talking with them about this. We want to work alongside them and our other partners in order to make this happen. The why of this is that there's an overlap of patients among these agencies. People that are seeing LifeWorks Northwest for some depression problems may also be suffering from diabetes, or they need assistance with Head Start services for their children. One of the reasons that this site and some other alternatives along the Max line were looked at is there are 7 continuous or coterminous census tracts that are designated medically underserved in the Beaverton core. We think Beaverton is such a rich, well-off city. It is. But as in other parts of Washington County, there are pockets of people that that do suffer from poverty and from other barriers to good health care. We know that health care in itself, though, is only 10% of the answer to you having a healthy life. It's what you eat. It's whether or not you have a job, whether or not you can get to work, whether or not you're exercising. We want to treat the whole picture, the complete picture of these patients. I'll wrap up with the how, and the how is that we've managed to put together several grants to keep the process going. The city plans on fading out of the role and turn this over to the Beaverton Community Healthcare Collaborative for them to run. We do not see an ongoing role of the city as being owner, operator. I will not be giving vaccinations or treating broken legs. I'm happy to go back and do accounting and budget work and a little planning on the side, involved with other issues in Washington County. But this is a facility that will be secured with 10 to 20-year leases from those partners that I mentioned when I started out. Most of those leases have been signed. There's a couple that are still in the letter of intent, moving towards signature. We were able to secure $1 million from the state of Oregon from its next issue of lottery bonds. That's what John McWilliams got to hear Senator Steiner Hayward talk about the other night. Because it's an integrative model that is different than what is going on elsewhere in Oregon, elsewhere around the nation, that's why we attracted some national developers. We think there's a great collective impact for Beaverton and for Washington County, and we're very proud to be able to come and present this to you today. We hope we can come back and tell you more of the story at a later time. Thank you very much.
Thanks.
I've got time for questions until till the lights shut off, and I'll be glad to stay around.
Cut you off in 6 minutes.
Thank you.
Rob, ask your question.
Hi, Rob.
David, hi.
On the microphone, please.
Sorry, you were playing with that. David, hi. Rob Solomon, board member. I'm just wondering, I don't know.
Sorry. 1 second. Try now.
All right. Oh my, okay. We'll try that again. Hi, Dave. Rob Solomon, forum member. When the planning started for this, there were a few more partners involved. One of the partners that pulled out, frankly, has me concerned. Any idea why the Washington County pulled out of the project?
Thank you. A good question. Washington County Public Health Department, and then one of their divisions, the Disabled and Veteran Services Unit, were involved, and initially were going to lease space in this building. They are still at the table, they're still talking, but they are not they've decided not to lease facilities. They may be involved programmatically. For example, the WIC nutrition programs may have some classes at the program. I don't want to speak for Washington County, but their issue seemed to be that they want to pursue their policy of owning their own facilities. And they currently have what I refer to as a postage stamp building on 2nd and Washington in downtown Beaverton. If you can find it, good luck. They want to build a better, bigger facility on their own. We're ready to assist them. Hopefully it's nearby. We're going to be involved programmatically anyway. It was disappointing, and that's one of the reasons the building has gone from maybe 100,000 square feet down to 70,000 square feet. But we're still going to work with them as best we can and move patients back and forth.
It was disappointing. Thanks.
Thank you.
Chris has got your last question.
Last question, please. Thank you.
Chris Leslie, forum member. Is this maybe creating a medical bubble, having all these facilities located in one place? When we have a new hospital going out in the Tannisbourne area, we have hospitals in Hillsborough, we have St. V's, we have everything. And you're taking all these, what we would prefer is local urgent care facilities. Have you thought about just keeping our urgent facilities in their locations instead of centralizing them in Beaverton? Or is this just a way to get rid of that property, the old film studio?
Well, that would be a nice thing to happen also, but that wasn't the primary reason we landed on that site after looking at alternatives. This facility involves partners who are currently in the Beaverton area in mostly leased space, some of which is undersized, inadequate. In the case of LifeWorks Northwest, they received some of those properties by merger. And it does not take away from the emergency care and the inpatient care at the hospitals. They're part of that service delivery system also. And it does not replace the urgent care facilities that are in the region, many of which are privately owned. This is about primary care and integrating services that are currently fragmented, but are serving are in fragmented locations, but are really serving many of the same patients and doing it in a centralized manner in a site that has excellent transit services. We believe when we finish the what they call the modality study, we believe that most of these patients, over 50%, will travel by transit and or walk. And it's looking at the 7 census tracts that are in and around that area that are really changing over time. You look at the 2000 census with the 2010 census, and it's a different demographic picture.
Follow up, why do you need parking then?
Well, part of it is the zoning code requires us to have a certain amount of parking. That district in the round is parking challenged already, especially if something else gets developed. There's the current parking structure that is, I'll use a kind term, is oddly shaped. I could use other terms. And there's the parking study that has been done just shows that in order for additional housing and offices and other mixed use development in that area, they're going to need more parking. It needs to be shared parking. This surface lot isn't just exclusively for the health center. It would be used by other projects in other development in that area, other customers. Thank you.
John Hutzler, board member. Can you give us a sense of the timeline of this project and what?
Try it again, please.
Can you give us a sense of the timeline for this project and what remaining contingencies there may be before it's certain?
Thank you. The intent is to be open in the summer of 2016. Working backwards from that, we do have to clear up a number of contingencies. The Westgate property, if this remains on the Westgate property, is owned 5 nights by the city of Beaverton and 4 nights by Metro. So we've got to work that out. I think the math, I think they worked back to those fractions. I don't think somebody dreamed that up. We have to remove that. We need to sign a development and disposition agreement with either the current developer with whom we're talking, Pacific Meadow Buildings, or a successor, but probably PMB. We have to finish raising our capital. We had a gap of about $6.2 million. The $1 million that we received from the state legislature, which would come out next spring, will help. We hope to come back to the next session because we said we'll settle for 1, but we need $3 million. We have several grants that are being pursued, and there is a federal healthcare facility construction program that we're hopefully will be funded by Congress in the next budget. It's in the president's budget proposal. It's a similar program to what has funded the Virginia Garcia facility in Cornelius, their new wellness facility. So we've got the operating cash. The projections look good. We just need to close that capital gap. And we are working on that. We would hope to have about another $2 million of that taken care of by about December. We need to hit some milestones or be realistic about it. Thank you, John.
How about a hand for Dave? Thank you so much.
You're welcome.
Folks, let's wind down really quick. I want to let you know that next week we have 3 Republican House District 32 candidates, and we also have the Republican 1st Congressional District candidates. Thanks for being here. See you in a week. Bye-bye.